needle EMG, or EMG as a whole, consists of the nerve conduction studies and the needle EMG. These are tests that are specific to the nervous system. They enable the neurologist to study the peripheral nerves, better able to localize the lesion, better able to give you a diagnosis and a prognosis of these peripheral disorders, whether it be it in the muscle, the nerves, or the neuromuscular junction. Patients can benefit from this study, whether they present with various peripheral nervous system complaints, such as motor dysfunction or sensory dysfunction. These tests usually are applicable to patients with a variety of disorders affecting the nervous system, including the muscle, neuromuscular junction, the peripheral nervous system, all the way up to the cell body of that nerve. Woodlands Hospital is the only place currently offering EMG studies, electrodiagnostic studies. Prior to us offering the service, we used to have patients travel overseas to get this study. So it's actually saving patients time and money, so they would have a timely diagnosis and the necessary treatment that is required. So here at Woodlands, we have the Natus Viking, which is one of the state-of-the-art equipment that is used for these kinds of study, and not just in Guyana, but internationally. This is one of the US most recognizable brand. So patients should rest assured that the quality of study is comparable to that of overseas. Patients, first of all, they have these complaints, they go to a physician, and the physicians generally refer the patient to the EMG to have those tests done. Usually what we do is initially do an electrodiagnostic evaluation where we validate the test if it's really and truly warranted, and then we would make specific recommendations to the different tests. Usually the EMG and the nerve conduction study, they're done concurrently, and one complements the other, and we get that test done in perhaps like about half an hour to an hour. The first part we usually do is the nerve conduction study to make sure the nerves are actually functioning well. And we test, for example, the velocity of the nerve conduction study, amongst other things. And then later on, we do the needle EMG part. So the patients are usually, they're explained usually the procedure, how it's done, and the preparation. It's usually connecting electrodes to the muscle that would correspond to the nerve affecting, and we would normally do a little stimulation. Patients would normally feel a little tingly sensation, a little minute electrical shock, and we would be able to capture it on the machine and determine the level of conduction or the affectation the patient might have. In the actual preparation for the day of the test, patients are asked not to, perhaps a day or two before the test, not to use any oils, any cream on the skin that might cause any impedance when we're using the electrodes to make a proper contact with the skin. The other thing is, if the patient they have to do the needle EMG part, since it's the more invasive part of the test, where we would take the needle to introduce it into the muscle to look for the activity. If patients, they usually bleed easily or they're on any blood thinners, such as warfarin, they should let us know to avoid any complications. After the test, patients would normally, the bleeding would stop. It's just a very small needle that is being introduced into the muscle, so bleeding should be very minimal. And the other part is patients usually worry afterwards. What happens after the little shock is, or the needle that is being used, they would feel a little pain, perhaps just a day or two, and any painkiller should reduce the discomfort.